Joining me now for a Eastern Ontario Health Unit COVID-19 update is our Medical Officer of Health, Dr. Paul Roumeliotis. Welcome back, Doctor.
Thank you.
All right, so Doctor, yesterday you, along with the Medical Officers of Health for some adjoining health units, issued a brand new directive regarding mandatory masks in enclosed public spaces. I'll let you take it away.
Yes. First of all, I want to qualify it by saying that the mandatory masking is only for interior places, public places where public has access. So that doesn't mean when you're outside walking down the street or going to the park or at home or whatever outside of those areas that you need to wear a mask. No, it's only for those places, and we are having exceptions as well. Obviously, if people have difficulty breathing, young children, people with cognitive or mental issues, or inability to put on a mask, and so on, there are obvious exemptions to it. So I'm saying this because I've received a lot of information about a lot of emails and social media about people worrying about that. So I just want to sort of right off the top reassure people that this is only for enclosed places when you go to shop, pharmacies and those type of things. Number one. Number two, we put the masking mandate as part of our approach, despite the fact that we have flattened the curve locally and across Ontario, by the way, because we do know two things. Number one, we know that the virus now, probably 30% or not more of the cases are transmitted from one person to another, with that person who has it not knowing that he or she has it. In other words, they're asymptomatic or pre-symptomatic. They don't have any symptoms before they show up the real symptoms, but they're infectious during that time. That's new. We did not know that a couple of months ago. We also know that now it's about 100 countries that have used masks, and in countries where they've used masks, they've actually been able to flatten the curve very successfully. And there are there's more and more scientific evidence that's building up. So in addition to social distancing, washing our hands, not going out when we're sick, now we're adding the masks as another layer of protection, because although yes, in the Cornwall and surrounding areas we've had little cases, there's still cases popping up all over Canada, and we're about to go into stage 3, which is going to open up businesses even more, expose more people. And we're going back to school in the fall. We're worried about a second wave coming in the fall, where this is tourist season, a lot of people are coming and going. So we just wanted to ensure that everybody started getting used to it. So then collectively, as we approach the fall, as we open to stage 3, we're able to, again, keep those numbers down, flatten them, and in a controllable way. So it's not that we're doing it for nothing. People are saying, well, we have no cases here, why are you doing it? Well, it's because if you look at the United States, Florida, in 1 week, went from 100,000 to 200,000 cases. That's because they opened everything up. They didn't bother wearing masks. They didn't do anything. We don't want that here. We want a very slow, steady progression to stage 3. We want to be ready for the fall. We want to be because we know there might be a second wave. We want kids to go back to school as normal a way as possible, and so that's why we did it. It's not because we wanted to take people's human rights away. It's not because we wanted to do things for nothing. We are doing it along with 100 other countries and most of Ontario at this point. So I think that people should understand we're doing this because we know that there likely will be a second wave. And again, because we understand better what we can do, so we're in a better position now before a second wave than we were before a first wave, because we didn't know much about the virus. As we learn, we're going to change. It's not that we made a mistake. It's not. Now we're building on the knowledge that's been built up with the experiences, not only with us, but literally with 100 other countries worldwide.
Absolutely, and as you alluded to, we can certainly see the warning signs from other countries of what happens if nothing is done. And one other thing you mentioned that stands out is it's very important to remember that this is just one tool in the kit, and wearing a mask, everybody wearing a mask, does not preclude the need to social distance and follow all other guidelines that are in place in stores.
It's exactly that. And the reason we wear the mask, really, Gabriel, is because the mask, itself, if I wear a mask, it prevents me from spreading my germs. If you wear a mask, and I protect you, so you're protected. If you wear a mask, I'm protected from your germs, right? If everybody wears a mask, the germs don't have anywhere to go. They just stay in the mask. So it really has to do with anything in front of you. Like even if you walk around, if you have a plexiglass, look at the stores. A lot of the stores that have plexiglasses, for example, they don't need to have a mask because they're protected, right? You're protected both ways. So as long as we understand why we're doing it and how we're doing it, and it's in addition to social distancing and washing our hands, and very importantly, not going out. We've got people who have been sick and had been in contact with other people they shouldn't have. So those are the type of things that we need to do collectively, because I think we did a great job locally and across the province in flattening that curve. But you know what? It's not over yet. We're still in a pandemic. As of this morning, there were close to 12 million cases worldwide, 3 million in the United States. From Cornwall, it's across the river, New York. So it's close by. It's not. We don't have it. Thank goodness. Thanks to all the work we've been doing, but we want to keep it away.
And we absolutely want to keep it up. And another thing that's important to remember is proper mask etiquette. Of course, there's on the Eastern Ontario Health Unit website, there is some advice as well on how to properly wear a mask and such things. So maybe we could talk a little bit about just your advice in terms of mask etiquette.
Well, the mask etiquette, obviously, first of all, we're talking about face covering. So it could be a cloth mask. It could be even a scarf or a bandana. It's better than nothing. People have been asking me about face visors. They're not as effective as masks covering the mouth, but if you can't wear a mask, this is a good alternative. In terms of etiquette, obviously, the most important thing you need to do is every time you go and touch your mask, before taking it off, after taking it off, you need to wash your hands. That's the most important thing. And obviously, make sure you keep the mask clean in a cloth. Don't share the masks, obviously. And like I said, we will have on our website a whole slew of information about how to wear a mask, how to put it on, how to maintain it. And importantly, we're putting together a whole section of frequently asked questions about masks. Where can I wear them? Why should I wear them? All the questions that we're getting.
And of course, the directive was put in place as of today. There's a grace period till the 14th, but you alluded to yesterday that there's going to be a great education component to this. It's not going to be a crackdown.
Oh yeah, we want to do this in an educational way, in a way that people can buy into it, get used to it, rather than fine people with fines. Obviously, our goal is to educate and to get as many people as possible masking. Studies have shown the higher percentage of people wearing masks in public indoor spaces, the better the chance of defeating the virus. Very simple.
On that note, Doctor, thank you so much for joining me for this update and enlightening our viewers on this new directive.
No problem.